Minister Joe Phaahla has attributed the recent plateau in infections to the reopening of schools. While infections have declined, more youths aged 20 years and younger have tested positive. This is in part due to reduced restrictions and the return to school. According to the Health Ministry, Gauteng, Mpumalanga and the Free State recorded the most new infections.
The last 14 days, even the last 7 days, have started to give a more confusing picture. We have seen a less resilient decline in the infections. The picture we have seen has been almost that we can call a stalemate, where there is no serious decline, and yet we can't say there's any worrying rise in infection.
South Africans will also be required to continue wearing face masks. The isolation period for those infected with symptomatic COVID-19 has been reduced from 10 to 7 days. Contact tracing of those infected and the need to isolate for asymptomatic cases will no longer be required.
The big thing about it is that we really, in terms of quarantining, we're quarantining contacts of cases. But it turns out we don't find a lot of the cases, and that's not at all unique to South Africa. That's the case in almost all the countries, apart from very few countries which test almost absolutely everybody. But for the vast majority of countries, we're actually only finding a minority of cases, and that's a very small minority of cases. In South Africa, it's probably less than 1 in 10.
Meanwhile, a subvariant of the Omicron variant has been discovered. The department has urged South Africans not to be alarmed following a lower death and hospitalization rate in the fourth wave. And it confirmed that the fifth wave can be expected towards the beginning of the winter season. Mbalenhle Mthethwa, SABC News, Johannesburg.